So Dr. Pan, full name is Dr. Pawinee Kulnanan, is from the Center of Elephant and Wildlife Health, the Faculty of Veterinary Medicine from the Chiang Mai University in Thailand. She's a veterinarian who spends most of her time on the road with the Elephant Mobile Clinic in Northern Thailand. She works closely with mahouts and communities to improve elephant health, welfare, and emergency care. Her presentation today is On-Site Elephant Care Insights from the Mobile Clinic. So we will now play her recorded presentation. It's not audible, Daniel. There's no sound.
I'm sorry, there is some problem with this. And then anyway, Dr. Ashik will just, share the presentation now.
สวัสดีค่ะ Good afternoon everyone. My name is Pawinee Kulnanan, or you can call me Pan, from the Center of Elephant and Wildlife Health, Faculty of Veterinary Medicine, Chiang Mai University. Today I'm very happy to share with you our real-world experiences from the mobile elephant clinic, the work we do on site, the challenges we face, and important lessons from the field. Let me begin with a brief introduction. I graduated from Chiang Mai University with a Doctor of Veterinary Medicine in 2019. After working as a lecturer at Waialak University for 2 years, I joined the Center of Elephant and Wildlife from 2021 to 2025. Now I'm continuing my journey as a PhD student in veterinary science, still working closely with elephants as part of my research and mobile clinic duties. You can contact me anytime at my email listed on the slide. About the center, our center was established by the Faculty of Veterinary Medicine CMU in 2010 with a mission to conserve Asian elephants and preserve elephant-related culture through research, veterinary services, and education. We work on several key areas: elephant welfare, studying stress physiology and welfare indicator, reproduction and genetics, breeding management, genetic diversity, and immunocontraception. AES, we study about the pathogenesis, viral shedding, pharmacokinetics, epidemiology, immunity, and potential vaccines. In elephant health aspect, the study about hematology, disease investigation, the plasma therapy, gait analysis, and elephant blood group. Our center is not only a research unit, it is deeply connected with elephant camps, mahouts, and communities, especially in Northern Thailand. Through education, research, veterinary care, and community partnership, we work to protect the Asian elephant, the symbol of our nation and our university. To understand the demand for mobile services, we must look at the national picture. Thailand has around 3,500 captive elephants, with the northern region holding the largest number, about 900 to 1,000 elephants. Chiang Mai alone has around 830 to 880 elephants, mostly involved in tourism activities such as feeding, bathing, trekking, riding, and observation programs. This high density means that on-site veterinary care is essential, and that is where our mobile clinics comes in. Our mobile clinic primarily operates in Chiang Mai province, providing on-call services. We handle with the non-complicated cases, which we do on-site treatment and follow-up. In complicated cases, we provide initial care and refer to TECC hospital. For the emergency cases, especially trauma, colic, and EHV as well, we also join the government agencies like the LD and TECC for annual health check and population census twice a year, including microchip check, deworming, and health monitoring. Our equipment is fully mobile. We have a truck supported by Asian Elephant Support and carry medical boxes with everything from drugs to wound care materials, eye medications, and cool box for biological sample. In each year, we perform more than 150 services on site. From the information I have gathered last year, it reveals that wound and abscess is the most common problem, followed by gastrointestinal problem, musculoskeletal problem, eye problem, respectively. And next, I will share example cases we did. One of the most common problems we encounter is wound and abscess cases. Elephants can get chronic irritation. In acute cases, we clean wound with normal saline, chlorhexidine, povidone, and apply ointments. Sometimes we need bacterial culture or laser therapy. So let me share a few samples. Tail bite injuries are something we encounter quite often. So when you come to Thailand or in Chiang Mai, so many elephants in Chiang Mai have a blunt or shortened tail because of tail biting behavior. The photo here comes from two separate cases. The most important thing in this situation is to immediately check whether there is active bleeding. In both of these cases, the bleeding was quite severe, almost like a broken pipe, so stopping the hemorrhage was the first priority. In the right picture, you can see the tailbone protruding, surrounded by necrotic tissue. This type of injury requires careful debridement to remove dead tissue, followed by proper wound cleaning and bandaging to support healing. The genital wound can occur in both male and female elephants. On the left, this is a 24-year-old male with a genital laceration following mass period. This type of wound requires gentle handling, thorough brushing, and regular wound care. In this case, the mahout was able to clean the wound during bathing when the pain is relaxed. We use normal saline for cleaning and apply Silverderm ointment. So on the right side is a case of myecid at the vestibule. there was a large opening filled with maggots. During the first screening, so I flushed with the ivermectin injection, and oh my, a huge number of worms immediately fell out. Once the worms were removed and the necrotic tissue was debrided, the wound healed rapidly with routine care. This case involves a knife cut on the trunk. Luckily, even though the trunk is full of blood vessels, there was no major bleeding. The wound was actually quite deep, penetrating toward the backside. We gave short-term pain medication, cleaned and managed the wound properly, and used laser therapy. With regular treatment, it healed completely in just 1 month. The next case is a knife cut on head, and honestly, in our field, we meet both good mahouts and those who sometimes make poor decisions. During the acute stage, the wound was swollen and inflamed, so we couldn't immediately assess how deep it was. Head wounds are always concerning because we must consider whether the scalp or the sinus may be involved. And this is a 5-year-old female who was injured by a broken glass bottle. She received routine wound care and tetanus vaccination. The wound was located at the lip. So in this case, we recommend using a nano spray that is approved for application inside the mouth, but the violet one is the gentian that the owner applied before. The pesticide injection can lead to oral ulcer, and we often see this in elephants living close to agricultural plantations. Exposure may occur either from directly eating or drinking the pesticide product or indirectly through contaminated roughage. These cases commonly involve organophosphate or carbamate toxicity, which can cause erosive and ulcerative lesions along the mucosa of the digestive tract. If the exposure happens recently, our first step is decontamination using normal saline to flush the mouth. Since this chemical can irritate the gastrointestinal tract, we usually administer GI protectants such as omeprazole. Additional supportive care is given depending on the severity of the clinical sign. Basal wounds are commonly found over bony protuberance. Chronic pressure in this area can lead to ongoing inflammation and the formation of the firm mass, which may eventually develop into an abscess or simply remain as thickened connective tissue. In some cases, the pressure causes the area to rupture, creating an open wound. These wounds require consistent and routine wound care to prevent infection and promote healing. And this is a 7-day-old cat presenting with swelling and pus from the umbilicus, which is diagnosed as omphalitis. This case highlights how crucial hygiene and regular cleaning are for newborn calves. The environment, especially the floor, requires close attention to keep it clean and dry. We demonstrated to the mahout how to properly clean the wound, flushing with normal saline, wiping with sterile gauze, and applying a betadine solution. However, caring for newborn can be challenging. Right after I finished cleaning the wound, this little calf used her dirty feet to scratch the area again. This case involves a 35-year-old female with a chronic wound that had persisted for an entire year. When the mahout first contacted us, he requested antibiotic injection because the wound had never healed. However, the problem was not a lack of antibiotics. The true issue was the need for proper debridement, consistent cleanliness, and environmental management. When we arrived, the wound was extremely dirty, covered with mud and debris, and it was difficult to even see the actual wound surface. After thoroughly debriding and cleaning the area, we discovered that the wound was much broader and deeper than expected. So we planned a treatment protocol, including routine wound care and laser therapy. In addition, we advised the mahout to stop the elephant from playing in mud or dirty area, keep her in a clean, dry concrete floor, and clean the wound twice a day. With proper management, the wound improved dramatically over the following month. In the first week after debridement, the wound measured 14 times 11 centimeters, and weekly laser therapy, the wound gradually reduced in size. After 3 weeks, it had already decreased to 11 centimeters. By 2 months, it had improved further to 9 times 6 centimeters at 3 months. It measured only 7 times 4 centimeters, with healthy granulation tissue filling in. Finally, about 4 months, the wound had healed completely. Chronic wounds in elephants do not always need more antibiotics. They need proper debridement, cleanliness, and environmental control. Foot abscesses are also common, often caused by stepping on sharp objects, leading to deep anaerobic infection and lameness. Management includes widening the wound for drainage, foot bathing in povidone solution or potassium permanganate or magnesium sulfate. Tetanus vaccination is needed in most cases. Proper nail trimming to improve weight bearing is suggested. And this might be scary a little bit. The trunk is very difficult area to treat. So this case involved a 40 years old female crushed by a tusker. Of course, make sure to stop bleeding first. We perform standing sedation, explore the wound, clean and bandage. However, part of the wound dehisced after when we encounter a lot of pus. After changing the topical medication based on drug sensitivity, the wound improved. Gastrointestinal issue, especially colic, constipation, diarrhea, and bloat, are extremely common. Elephants have very sensitive digestive systems. In Thailand cases, the triggers include cold weather and reduced drinking, dry lavage, large meal, large amount in one time, too much fruit, soy eating, mental problem in older elephants. For gastrointestinal problem, we rely heavily on good history taking, careful observation of behavior, and transrectal examination to assess fecal characteristics, rectal contraction, and temperature. Elephants with GI issue commonly show signs of abdominal discomfort, such as reluctance to move, decreased appetite, lying down more often, opening the mouth, abdominal distension, or placing the trunk in the mouth. The treatment approach is generally similar across most GI cases. We provide supportive care, including fluid therapy, NSAID, GI protectants, GI promoters, anti-gas medications, vitamin supplement, and rectal enemas when needed. In addition, simply encouraging the elephant to walk, can be very helpful as movement stimulates gastrointestinal motility and significantly improve recovery. In this case, the owner reported that the adult elephant appeared bloated and had a history of eating soil. During the transrectal examination, we found moist, thus milk feces, which supported the suspicion of gastrointestinal disturbance related to soil consumption. Fortunately, she was still drinking and eating. Based on the findings, I decided to administer a GI stimulant. Shortly afterwards, she passed a large amount of watery feces. The gastrointestinal mortality increased noticeably, and the accumulated gas was released. And as you can see in the picture, poor carp, her mother's feces dropped right on her head during the process. Blood in elephant can become critical very quickly, especially when they stop eating or drinking. The severe distension of gastrointestinal tract can expand to the point that it put pressure on the diaphragm and lung, reducing the elephant's ability to breathe effectively. One particularly challenging situation involved 8 elephants in the same camp developing severe bloat at the same time. The suspected cause was grass contaminated with urea fertilizer. Because the situation was urgent, we quickly assessed and categorized each elephant based on severity to guide our management. After initial treatment with pain relief and anti-flatulent medication, 2 elephants were immediately referred to the hospital, and another 2 were sent the following day. But unfortunately, despite intensive care, 2 of the elephants died due to severe sepsis and acidosis. For the elephant treated on site, those in the more severe category received fluid therapy, pain control, and intervention to promote gastrointestinal movement. Those with milder signs we treated with pain medication and anti-gas drug, and we encourage working to help release gas and stimulate motility. Many blood cases occur in the rainy season, especially in elephants with a history of soil eating or eating improperly prepared grass. In this case, the elephant did not improve after showing signs in the morning. Gastars were present but very weak. Treatment include pain relief, GI promoter, and anti-gas medication. Next is a case of constipation. This 50-year-old elephant has severe constipation due to tooth loss. It occurs during the cold season when elephants tend to drink less. Combined with poor chewing ability, this leads to a large, hard, dry fecal impaction. The first sign was very small amounts of feces. On transrectal palpation, we couldn't feel any fecal mass at all, indicating a deeper or firmly compacted blockage. The supportive treatment is performed in day 1. This elephant went almost 4 days without passing any feces. We provided fluid therapy and supportive care throughout the period. Lidocaine CRI was started and neostigmine was used on day 2 and again on the final day. On the last day, we were finally able to palpate a large, hard, compacted fecal mass near the anus. The elephant showed frequent straining, almost like labor sign. We worked for nearly an hour to remove the impaction, and once it came out, a large amount of feces followed. For long-term management, we changed her diet to chop grass to make chewing and digestion easier. Constipation can also occur in young elephants. These elephants show pale mucous membranes and abdominal discomfort in the evening and had not passed feces in the afternoon. She did not tolerate fluid therapy well, so we provided pain relief, performed a little enema, and encouraged walking. By the next morning, the owner reported increased pain and that she was sitting down frequently. On palpation, we could feel feces close to the rectal sphincter. After spending the day walking uphill and playing in the river, she was finally able to expel a large fecal mass. And this is a 3-year-old elephant presenting with depression and diarrhea, with visible sour mixed in the feces. Because of the age and clinical sign, we were initially concerned about EHV, so we checked immediately. The fecal exam revealed a heavy parasite load and EHV test was negative later. In this case, the elephant was received deworming drug 3 days consecutively. Prolonged diarrhea can lead to intestinal bloat. In some cases, we administer hyoscine to help reduce abdominal discomfort along with NSAID and make the elephant more comfortable. Next, we will move to the eye problems. Corneal ulcers are very common in elephants and tend to occur more frequently during the summer months. Typical clinical signs include sepia or fully closed, a whitish spot visible on the cornea. So we perform fluorescein staining in every suspected ulcer case to confirm the lesion. For uncomplicated ulcers, the treatment is straightforward. Regular eye drop, keeping the elephant out of the mud, providing shade, and giving pain relief if needed. However, for elephants that are difficult to manage on site or show more severe signs, we recommend referral to the hospital for further diagnostic workup and more intensive care. For more complicated eye cases, we may perform a corneal swab to adjust the eye drop regimen based on culture and sensitivity results. We also use ultrasound when we need to assess deeper ocular structure. In Thailand, we now also apply mesenchymal stem cell therapy in the treatment of corneal ulcer. This method has shown excellent results with significantly faster healing times and recovery. This case really surprised me. The owner called urgently reporting that the elephant had stick penetrating her eyes. She was normally kept on a long chain in the forest at night, and when the mahout came to bring her back in the morning, he found the injury. When we arrived, we examined the eye closely and gave pain relief first. We rinsed the eye to remove dirt around the area, applied the lidocaine eye drop, and then used forceps to carefully remove the foreign body, which turned out to be a piece of a bamboo stick. Because of the severity and the risk of deeper damage, this elephant was referred to the hospital for an eye ultrasound and intensive ocular care. And next, EHV. EHV is always treated as an emergency. it can cause death in calves within 48 to 72 hours after the first clinical sign appear. Early signs can be very subtle, sometimes just mild depression. The virus attacks the blood vessel, leading to hemorrhage, edema, and rapid deterioration. In the field, we begin with careful observation and physical examination. Most infected calves present with fever. When the clinical signs are obvious or progressing rapidly, referral to the hospital is often the best option for intensive life-saving care. If the calf is still eating, we start treatment immediately with antiviral medication and vitamin C. But sometimes some may be stopped clinically and show only minor abnormal signs, so the blood check and PCR are needed. And training is always important for PE and sample collection in calf. This is a 5-year-old male elephant with mahout reported that he has been depressed for 2 days, and later he developed facial edema and hemorrhage on the tongue. After being transported to the hospital, he was diagnosed with EHB type 1 and type 4 co-infection. Unfortunately, despite treatment, the outcome was not successful. So the truck ticket was a one-way trip. This is another case, a 4-year-old elephant presenting with depression, facial edema, and high fever, very high. Unfortunately, this calf also did not survive another one-way ticket. Our latest case this year, a 2-year-old calf, showed a similar sign and got bad odor, feces with mucoid covering. He was attacked with EHB type 4. So after I went there at 4 p.m. and he was sent to the hospital by 9 p.m. but in 1 a.m. of the next day he passed away. Now I will share you about the uncommon cases, or maybe common for you, I'm not sure. The tiny calf. This calf born in an uncommon small size like a dog. It cannot reach to the breast. Mahout have no experience about this, and the mother had less milk. So many organizations put their hand to help, suggested to make an upfloor at the stall, change the mother during taking the calf for milk, and supply the mother with domperidone to promote milk letting down. Abortion. This case is a young adult that the owner did not know she is pregnant. One day, the mahout found the protrude of white sac and rupture, but she did not giving birth nor show laboring sign. The blood check revealed low serum calcium. Initial treatment is using of oxytocin and calcium borogluconate. 3 days later, the ultrasound of our fetus reads at right quadroventral abdomen, but no signal of the heartbeat. Mother is still bright and alert and has normal signs, so the owner wants to observe her sign at camp and not decide to send her to the hospital. So, however, we also give the possible complication and consequence from this. 7 days later, she showed the labor sign and aborted fetus was expelled, but retain of placenta occurred. After that, some purulent vaginal discharge always present every day, along with the antibiotic treatment. Finally, 21 days later, placenta was expelled. The necropsy is also part of our responsibility. It helps us understand disease patterns, confirm diagnosis, and improve future treatments. Although it is physically and emotionally challenging, it is essential for elephant health research. Over the years, our mobile clinic has expanded our on-site diagnostic tool, including portable X-ray, ultrasound machine, tumor camera, laser therapy, ultrasound therapy. So these tools allow us to diagnose faster and treat more effectively, even in remote locations. So working with elephant means going everywhere, mountains, river, forest, wherever the elephant need us, we go. And no matter how difficult or exhausting the situation may be, we remain committed to providing care. And lastly, we are now establishing our own hospital under the Center of Elephant and Wildlife Health in Chiang Mai. So this will allow us to provide more effective and comprehensive health care for elephants. It will also serve as an educational center for students and veterinarians to develop their skill and advance treatment practice. And I would like to express my sincere thanks to Asian Elephant Support for supporting our work and making the mobile clinic possible. And thank you very much to Wildlife Trust India for giving me a chance. And thanks everyone for listening. So I'm so sorry that I'm not available online. So if you have any question or would like to discuss any of the cases further, please feel free to contact me via the email.
Yeah, that's just great. Dr. Pan is in the field right now. She's not able to join with us. Anyway, we have a few questions from the participants, Nirupama, and then Dr. Nirupama, Dr. Alexandra, and also Dr. Madafera. And we would like to just, keep this platform for some more time open, so that if you have any questions, you're most welcome to, drop it in the chat box. We'll be more than happy to just, send it back to all the questions to Dr. Pan, and then the replies given by the Pan will be just sent through email and also posted in the WhatsApp group. Okay, with this, I think we just closing the webinar. The next webinar of this series will be informed to you. There are a lot of other requests from the participants. We'll try to, get so the suitable presenters, suitable resource people to just address all those interests for the participants. Thank you once again, all of you, for your time and for taking part in this webinar. And then if you have more questions, please keep posting in the chat box, and then we will keep this open for the next 10 minutes. Thank you so much. Yeah, with this we close.